Let's bring in Dr. Amesh Adalja now. He's senior scholar at the Johns Hopkins Center for Health Security and infectious disease specialist. Doctor, thanks. Sorry about your name there. If you were advising a school on how to keep kids in the classroom right now, what would you be recommending?
I would be recommending that they get their children vaccinated, they get all of the staff and employees vaccinated, and that they use the guidance that the CDC has provided of testing to stay. So if you have exposures, you don't need to send the whole classroom home. You can test people, and if they're negative, they can stay. The priority has to be in-person schooling, because we know children have been really damaged by this pandemic, not because of what the virus did to them, but what adults did to them. So there are best practices. And remember, in the pre-vaccine era, we could keep schools open even when the pandemic was raging outside school doors. So this has to be the default.
Interesting. Some schools are also requiring students to wear N95 masks or encouraging double masking. Is that a realistic ask, and how much of a difference does it make?
I don't think it's a realistic ask, because an N95 mask, for anybody that's worn it, it's not something easy to wear for a long period of time, especially if you're a child. So I don't think that that's the right way to go. I think a well-fitting mask, a surgical mask, that's probably the best thing to do. And remember that COVID is not going to go anywhere. We're going to have to develop a tolerance for cases, because cases are going to occur 20 years from now. And I think we have to come up with a sustainable approach to keep schools open and have less of a focus on cases and more of a focus on severity of illness, which is unlikely to occur in children.
Dr. Scott Gottlieb says it could be only about 2 weeks before cases peak in New York City. Does that mean, let's take that nationwide, that schools should be more conservative, maybe shut down for the next couple weeks until it passes, or less conservative because this is going to pass quickly?
Less conservative. As I said, there are a lot of best practices that you can put in place to keep children in classrooms. You don't have to panic over this new variant. Yes, there's going to be cases, but they're going to be manageable. This isn't the beginning of the pandemic. This is January of 2021. We have tools to be able to navigate a world in which COVID-19 is ever present. And I think this reflex idea that you have to shut things down is wrong, and it's not sustainable, and it actually damages children. So I think what we have to do is use the guidance that we have in order to allow children to learn in classrooms. Vaccines, testing, and we have treatments for people if they do get severely ill. So this, in many ways, is not a rewind to the beginning of the pandemic, although there's a lot of panic over this new variant. We're in a much, much better place now at the end of 2021 than we were just even a year ago.
Finally, what would you say to those parents who are reassured by everything that you've been describing, but still look warily at the rise in pediatric hospitalizations?
Children tend to be spared from infection, but remember that children are the least likely group to be vaccinated in this country. That's where we have big gaps. And this virus is going to find unvaccinated people wherever they are. Children tend to not be hospitalized that much unless they have an underlying condition like asthma, an autoimmune condition. They have some type of immune suppression. In general, they're not going to be hospitalized at the same frequency as adults. However, they are going to get hospitalized when there's surges in cases and there are some high-risk children. Those children are best protected by getting them vaccinated. And remember, a lot of these cases could be incidental pickups, because many hospitals are testing everybody that gets admitted. And some of these cases are not necessarily related to COVID. They're there for some other reason and get picked up as COVID. So I think parents should be reassured that COVID is targeting children, but just get their children vaccinated. That's the best way to ensure that they won't have any issue with COVID.
All right, a stressful time of year for all these parents and kids. Dr. Amesh Adalja, thanks again. We appreciate it.